Good afternoon and welcome to the 4th Annual Northeastern Central Pennsylvania Interprofessional Education Coalition Collaborative Care Summit. The goal of this summit is to allow students the opportunity to learn from, about, and with each other. As part of this learning process, we've created a short video to briefly describe how each of these professions contribute to the care of our patients. We hope you enjoy it.
Hi, my name's Julie.
And I'm Brianne. We are students from Marywood University's Baccalaureate 4-year nursing program. The nurse, in all professional relationships, practices with compassion and respect for the inherent dignity, worth, and uniqueness of every individual, unrestricted by considerations of social or economic status, personal attributes, or the nature of health problems.
The nurse respects the worth, dignity, and rights of all human beings, irrespective of the nature of the health problem. The worth of the person is not affected by disease, disability, functional status, or proximity to death. This respect extends to all who require the services of the nurse for the promotion of health, the prevention of illness, the restoration of health, the alleviation of suffering, and the provision of supportive care to those who are dying.
We are privileged to be able to work in acute, chronic, and community settings. With further education, we can practice as a nurse practitioner, nurse anesthetist, or midwife, to name a few of the possibilities.
We are proud to be members of the healthcare team. Go nursing!
Hi everyone, I'm Kristen.
And I'm Taylor, and we're second-year graduate students in the Physician Assistant Program at Marywood University. We're here today to talk to you about the role of physician assistants in the medical profession.
So let's start with a general definition of what a physician assistant is. A physician assistant is a member of a healthcare team who always works under the supervision of a physician. We are allowed to practice in all 50 states, including the District of Columbia, and we are allowed to prescribe medications and practice medicine. When it comes to what a PA can do, we are allowed to do physical exams, diagnose and treat illnesses, order and interpret labs, perform procedures, assist in surgery, and educate our patients.
PAs can be found in a variety of settings, in the hospitals, in surgical suites, in outpatient and doctor's offices, as well as in the emergency room. Most people get into this profession because they're drawn by a desire to help people and the flexibility it offers when changing specialties.
Hello, I'm Eric, and I'm a student in the Johnson College Radiologic Technology program. As radiology technologists, it is our responsibility to assist the radiologist physician with the process of imaging and diagnosing illnesses. You will find technologists working in doctor's offices, outpatient facilities, and throughout the hospital. Within the hospital, you will see us in the ER, OR, and other specialty areas such as MRI and CAT scan. When obtaining the best quality images, it is our duty to ensure the patient's safety and comfort. Because there is no safe dose of radiation, accurate positioning and exposure factors are important to keep patient doses to a minimum, while still obtaining a quality image. Knowing the anatomy is a vital part of taking x-rays. Without the knowledge of anatomical structures throughout the body, it would be impossible to provide the radiologist with diagnostically accurate images. The radiology department is an imperative part of the medical system, and as technologists, we play a key role in patient care and diagnosing critical illnesses. We are an integral part of the medical team.
Hi, I'm Rachel, and I'm part of Misericordia's Diagnostic Medical Sonography program. Sonography is a diagnostic medical procedure that uses high-frequency sound waves to create real-time images of organs, blood vessels, and soft tissue within the body. A sonographer or ultrasound technologist is a highly skilled, credentialed professional that uses equipment to create images of structures within the body that are used by physicians to make a medical diagnosis. Professional responsibilities include, but are not limited to, talking with the patient to identify their symptoms, performing the sonogram and obtaining diagnostic images, analyzing patient information, using independent judgment in recognizing the need to make changes to the images, providing an oral or written summary, of the technical findings to the physician for medical diagnosis, working with physicians and other healthcare providers, and providing quality patient care. Many sonographers also assist in electronic record keeping and computerized image storage. Sonographers may also have managerial or supervisory responsibilities. Although the most familiar use of sonography is with obstetrics, ultrasound can show you so much more. Sonography is used to evaluate blood vessels, soft tissue, and organs within the abdomen. It can evaluate small parts of the body, such as breasts, thyroid glands, lymph nodes, and even testicles. Sonography can evaluate the heart and its anatomy and function. Neurosonology is used to evaluate the brain and spinal cord in infants. And obstetrics and gynecology is used to evaluate a developing fetus and female reproductive system.
Hello, my name is Katie, and I'm an occupational therapy student at Misericordia University. Occupational therapy helps people of all different ages and conditions to become more independent in the things they want and need to do on a daily basis. OT is a client-centered practice, which means the therapist works closely with the client to create and work towards achieving goals. These goals are centered on occupations that the person needs to do each day, such as dressing, bathing, and leisure activities that are especially important to the individual. Occupational therapists also work towards adapting the environment or tasks to help the person regain independence in these areas. Occupational therapists work in a variety of settings for the pediatric, adult, and geriatric populations. These settings include, but are not limited to, early intervention, school-based therapy, inpatient rehabilitation, outpatient rehabilitation, hospitals, and skilled nursing facilities. Depending on which area the OT works depends which role they play on a healthcare team. Very often, occupational therapists work with physical therapists, speech-language pathologists, physicians, and nurses. Many people are drawn to work in the OT profession due to the personal nature with the clients and the reward they get when clients are able to regain independence.
Hi, my name is Tori, and I'm a speech-language pathologist student here at Misericordia University. If you've ever watched The King's Speech, you've probably heard of Lionel Logue. He provided services for stuttering for King George VI in the early 1900s. And as early as 1925, our profession has grown and evolved into something that's more comprehensive and client-focused. Speech-language pathologists work in a variety of settings, from home health to rehab, nursing homes, private practice, general hospitals, and school systems. Our clients can be as young as birth to 3 to adults in their final stages of life, and our areas of specialty are just as diverse. Speech-language pathologists, or SLPs, help with articulation, voice, swallowing, language, and cognition. And so there's a lot of flexibility in what we can do and who we can work with. But regardless of what we're doing and who our clients are, I think that we will all agree that we really appreciate collaboration between disciplines. And so you'll often find speech pathologists working with OTs and nurses, teachers, physicians, family members, and even psychologists to implement and create the best course of action for our clients. Speech-language pathologists are often called upon to be advocates, allies, teachers, and counselors for our clients. And we work tremendously hard to provide them with the highest level of care and attention so that they can have the best quality of life and communicate effectively.
Hi everyone, my name's Greg. I'm a third-year physical therapy student here at Misericordia University. So what do physical therapists do? Well, we use movement analysis and interviewing a patient to find out their goals to help patients obtain their maximal functional status and improve their overall quality of life. So we deal with patients all across the lifespan, whether it's infants and children, teenagers, middle-aged adults, all the way up to the elderly. And what we do is we take our functional, task-oriented approach and apply it directly to the patient to help them obtain their goals. So for instance, if we had an athlete come in who sustained an athletic-based injury, we would, through our interview, find out what their goals are and how we could help them get back to that sport. And throughout our treatment, we would put them through sport-specific exercises and tasks so they not only were able to return to that sport, but also return to that sport safely. However, we're not only limited just to working with athletes. Say for instance we had a patient who had a stroke. Strokes are very complicated diagnoses to deal with, so what we would do is, through patient education, teach them new ways of doing tasks that they previously did in everyday life activity with just a new twist on it. So this could include weight shifting back and forth in your wheelchair to make sure that you don't get skin breakdown and avoid the occurrence of wounds. Also, we could teach them new ways to get up and out of their chair and walk around in the community just like they had previously, just with a little bit of an adaptation on it. So I know we've only scratched the surface here of what physical therapists actually do, but I hope this gives you a little bit of insight into physical therapy and how we help our patients obtain their goals and improve their maximum functional status.
Hi, my name is John Brady, and I'm in my final year of pharmacy school at Wilkes University. I'm here today to talk to you about the profession of pharmacy. I'd like to explain what pharmacists contribute to the healthcare team and where you can find us practicing. I'd also like to discuss why many of us chose to join one of the most trusted healthcare professions. The most common area of pharmacy practice is the community setting, such as a national chain, neighborhood grocery store, or locally owned independent pharmacy. In the community setting, you can find us counseling patients on medications and providing recommendations on over-the-counter products and supplements. We are the last point of contact between our patients and their medications. Therefore, we take great pride and responsibility in ensuring the safety and efficacy of the medications we dispense. We value our accessibility to patients and encourage them to approach us with questions whenever possible. In addition to providing valuable information to our patients, we work closely with their physicians, tailoring drug regimens to meet each individual's needs. We also offer some unique services, such as diabetic footwear fittings, and we protect public health by administering immunizations. The hospital is another setting where you can find many of us. Hospital pharmacists commonly work as part of an interprofessional team, rounding with physicians and other practitioners, providing evidence-based recommendations regarding the appropriate use of medications. We also help to control costs by managing drug formulary systems. And when our patients are ready to go home, we provide discharge counseling, ensuring that before they leave our care, they are comfortable with and knowledgeable of their medications. An emerging area of pharmacy practice is ambulatory care. Ambulatory care pharmacists practice in primary care centers, such as a doctor's office or clinic, where we collaborate with practitioners to actively manage the treatment of chronic diseases such as diabetes, hypertension, and dyslipidemia. In conclusion, pharmacists are medication experts. We chose the profession of pharmacy because we believe very strongly that by working with other healthcare providers, we can improve outcomes, enhance care, and impact the lives of our patients.
Hello, my name is Timothy Rigatti.
And my name is Aaliyah Cable.
We're paramedic students from Luzerne County Community College. Today we're just going to tell you a little bit about the profession of being a paramedic and how it differs from any other medical profession.
Paramedicine is the first line of defense, you could say, for patients. When someone has a medical emergency or a traumatic emergency, they call 911 and we're the people who come immediately. We begin our treatment with an assessment, find out what's wrong with the patient. We can provide the patient with things such as airway management, IV and fluid therapy, drugs that the patient may need to help them breathe better, to correct problems with their hearts, and even such things as nausea, vomiting, we can help the symptoms with. From there, we can transfer the patient to a hospital or the appropriate facility and transfer care to the doctor.
Paramedics aren't just associated with emergencies. They can also be used in interfacility transports. That's one hospital to another hospital. Or they could work as a technician in an emergency room.
We also can move up in our schooling. We can become nurses and doctors. Several of us strive to become part of Lifelight, whether it be as a Lifelight RN or a Lifelight paramedic.
Hello, my name is Amy Janeski. I'm a third-year student at the Commonwealth Medical College, and the main reason I decided to go to medical school was actually my interest in teaching. I taught for a couple of years, and I wanted to combine my loves of science and medicine along with teaching, so I decided to come to medical school. One of the highlights of this program is that we get to work in inpatient and outpatient settings and actually work with a lot of different professionals. So in a typical week when I go to my pediatrics rotation, I interact in the hospital with nurses and other physicians and case managers. Also on my psych rotation, I've been able to work with students from other universities in PA programs, nurse practitioner programs, and other med schools. I'm also lucky that when I go to a couple of different offices, because our curriculum third year is primarily outpatient based, I'm able to work with people that have been in the field for a really long time. And some of the people that I've learned the most from have been my preceptors, which are attending physicians, and also nurses that have been in the field for a really long time. Finally, the last part of our curriculum entails some afternoon didactic sessions, which are lectures, and we have different professionals come in, not just in medical field, but that come from pharmacy programs, that come from palliative care, and that come from social work. So that's a chance that we get to kind of work as a team while going out and experiencing the day-to-day life of a physician.
Hi, I'm Heather.
I'm Diane.
And we're nutrition and dietetics students at Marywood University. We'd like to share with you what it means to be a registered dietitian. A registered dietitian has the credentials to work in a clinical atmosphere. Here, they use medical nutrition therapy to help treat and prevent diseases such as cardiovascular disease, diabetes, cancer, obesity, and kidney disease. The registered dietitian also ensures that the patients are meeting their recommended nutrient needs while also giving the patient information on how food and disease are related.
Dietitians may work in hospitals, health maintenance organizations, private practices, or other healthcare facilities. Other career paths include community and public health, food service, business, sports nutrition, and corporate wellness. Dietitians provide an individual with the knowledge they need to help take control of a vital part of life, their diet. They build a rapport with the patient or client, encouraging them towards a healthy lifestyle.
Dietitians work alongside other professionals on a day-to-day basis, collaborating with physicians on appropriate diet orders and communicating with speech-language pathology on safe eating are just a few ways that dietitians are part of an interdisciplinary team.
Food and nutrition have a role in determining a person's health. Dietitians then play a role in promoting health and wellness for all individuals, working alongside other healthcare professionals to facilitate optimal health for patients under our care.
Hello, my name is Melody Collins, and I'm a second-year graduate student in the School of Social Work at Marywood University. I currently am doing my field experience at a medical clinic in Wilkes-Barre, PA, and I'm enjoying working with the underserved and providing healthcare services. I do a lot of one-on-one counseling and group work, and I also help provide prescription assistance and work in an interdisciplinary facility. Playing a germane role in diverse aspects of care, social workers work in a variety of settings. This assists with biopsychosocial spiritual assessments of clients. We need to assess factors that may be potentially influencing our clients, whether positively or negatively. We can then evaluate whether lifestyle changes are necessary for our clients. Social workers are also client advocates. We believe that social workers should promote the well-being of our clients. In doing so, we may provide resource assistance, which may be in the form of transportation, childcare, financial assistance, and sometimes even mental health care services for our clients. Part of our advocacy and assistance may include ongoing psychosocial services to the client and her or his family. Collaboration with other disciplines is key to success, especially in medical social work settings where one may need to collaborate with physicians, nurses, nutritionists, dietitians, and other professionals. This fosters communication among professionals, communication which is vital to providing the best possible services to our clients. Along with discharge planning, which is done in collaboration with our clients and their families, we need to provide other services for our clients. We're not done. Far from it. In fact, further assessment and evaluation are needed to complete the care treatment plan and follow through. As social workers, we are perpetually concerned with the common good, which requires relentless advocacy and empowerment for our clients. As Jane Addams stated, the good we secure for ourselves is precarious and uncertain until it is secured for all of us and incorporated into our common life.
All healthcare practitioners, including speech-language pathologists,
radiologic technologists,
occupational therapists,
pharmacists, and therapists, among others, need to understand the importance of communicating.
Working within healthcare teams,
and coordinating our efforts to provide care that is client-centered,
safe,
effective,
efficient, and equitable. Our performance must be guided by high ethical and professional standards. We need to recognize our own limitations, understand each other's roles and responsibilities, and learn to trust each other, our patients, and their families. As a team, we can make a difference.
So students like me,
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 us, and me can make a difference.